Well, if you feel as if your child's not meeting specific milestones, or if they're demonstrating behavior excesses or deficits that are troublesome, is that the first step would be to go and see your pediatrician. Get their input. A lot of times pediatricians can identify the gross abnormalities and being able to identify that this is a characteristic that is definitely related to autism. Other times they might feel, you know what, this is something that I'm not so comfortable with. I don't have the exposure that a developmental pediatrician might have, and they might refer out in order to get more specialized care. The developmental pediatrician at that point would be able to look at more of the specifics and be able to utilize their background and training to be able to identify what is the deficit, what is the diagnosis, but more importantly, what treatment should be coming from this. A developmental pediatrician, one of their primary focus is finding some medical causality, is to understand the condition a little bit better. They may order genetic testing in order to better understand what the causal factors are, or to be able to help guide the parents into making decisions on treatment planning, understanding the condition, understanding limitations, and then understanding their family dynamics. After that, they start to look at the mental health condition. They'll do a series of assessments, one of them being the ADOS, which is the Autism Diagnostic Observation Schedule. It is a 4-module assessment that looks at socialization skills. It looks at communication abilities, it looks at routinized stereotypical movements, and then it also looks at the way the child engages with the environment and their visual spatial awareness. During this time, they'll also be observing any sort of direct observations that they can get of the child interacting in the environment. They want to see if they're identifying any characteristics that would be typical of a child who presents with a developmental disorder. At the end of going through the evaluation process, after meeting with a developmental pediatrician, the parent should be walking away with a clear understanding of what is the developmental disorder that my child has. What are the deficits that I need to remediate? The parent should be walking away with what are the best treatment options? What are the empirically based treatment options? Which ones have research supporting them? So if we're going to be paying for treatment, what's going to be most effective for my child? They should be walking away with a list of resources as far as what treatment options are available in their community. And then the last thing they should be walking away with is just a support group. Is that any time where you're getting into a domain where you have not experienced it and there's others out there who can help guide, you want to be available and access that population. So you want to have a support group that you can talk to that can help you to navigate the system a little bit better.